Thank you so much for that lovely introduction. And it's so wonderful to be here this evening to talk to you and talk about this important topic of mindfulness for migraine. Can everybody see my slides? Ellen, y'all can see my slides? Okay. So first
Yeah.
Great. I want to define mindfulness meditation and talk about the evidence and research that's been done looking at mindfulness as a treatment option for migraine. I also want to discuss opportunities to engage and learn more about mindfulness, and then we'll end with an experiential mindfulness session. So I have no disclosures. So first, as patients with migraine and other headache disorders, I'm sure you're all familiar that medications can be wonderful. And Angel did such a beautiful job describing her story and her experiences with migraine and the life-changing effects of many medications. And we also know that, as many have described this evening, medications can be problematic with side effects. They're not always 100% effective, or they lose their effectiveness over time. Medication overuse headache is a common problem as well. And many patients often are prescribed or use opioids for treatment, and there are risks associated with that. And then there are times in life when medications are not always ideal, when individuals have additional comorbidities or medication interactions or during pregnancy or nursing. And non-drug options can be a great addition because they often have few side effects and can be taken concurrent with medications and often address other factors playing a role, not as the cause of headaches, but other factors can often feed the progression of headaches. And so mindfulness is a treatment option that might be helpful. And so what is mindfulness? So this is a definition from John Kabat-Zinn, where mindfulness is paying attention to whatever is happening in our present moment with qualities of openness, non-judgmentalness, and curiosity. And we're all born with a capacity to be mindful. It is an innate human experience. And when we spend time with children, we really see it. Children don't think about tomorrow or yesterday, but they're just right in the present moment. And often as we develop and our brains develop, the prefrontal cortex or the front of our brain develops, we engage and are able to think about the future and the past. And so it becomes more challenging to be and live in the present moment. And so mindfulness really is a sort of a state of being. We can be mindful in a given moment. It's also, mindfulness is a practice that can be experienced to build our daily capacity to be mindful. And so there's mindfulness meditation, where you actually learn the skill of practicing so that in your daily life you can be more mindful on a regular basis. And so the thought is sort of, without mindfulness, we have these stimuli in our environment, in our lives that happen, and we typically react. And the idea with mindfulness is that when stimuli happen, we can become mindful to have a choice to decide how we're going to respond. And this is one of the really powerful elements of mindfulness is having a choice in how we respond to stimuli that come to us. And so I've been really interested to see if mindfulness would be a treatment modality that would be helpful for people with headaches. And so I conducted a clinical trial where individuals learned mindfulness through classes called mindfulness-based stress reduction, which involves 8 weekly classes where individuals learn about mindfulness and practice experientially. The classes usually last about 2 hours. There's a standard curriculum for learning mindfulness. And in this clinical trial, individuals were either randomized to this 8-weekly 2-hour class or a waitlist control group, which meant they kept headache logs the entire time the intervention group was receiving the intervention. And then at the end of the study, they also were able to take the classes. And this study was specific for adults with episodic migraine, so those with 4 to 14 days a month. And individuals were instructed to practice at home 30 to 45 minutes a day. So it's a decent amount of daily practice that was advised. And when we asked individuals to track their daily home practice, we found that most people practice about 35 minutes a day at home. We found that after the intervention, those who had practiced and taken the class, their migraine attacks were less frequent, they were less severe, and they were also shorter. In addition, we looked at other measures to see if other factors were impacted in patients' lives and found that they had lower disability scores, their self-efficacy, or the feeling that they were in control of their migraine, as well as their mindfulness improved, emotional reactivity decreased, pain catastrophizing decreased, and pain acceptance increased. So pain catastrophizing is the sort of negative rumination or thoughts related to pain. And this was it was a small study of 19 individuals. This was what we would call in medical research a pilot study. And the goal of this study was to see if there was evidence whether or not it would be worthy to conduct a larger study. And I want to point out that this small study received national media attention through Time magazine. And I highlight this because it was an intriguing factor for me that this small, tiny study received such national attention. And I hypothesized that was probably because of a few things. Number one, so many patients with migraine are really looking for other treatment options. Number two, mindfulness is something that really has caught the media's attention right now. And then I bring this up as well because the media sometimes brings attention to studies that are tiny or small and sometimes can even be sensationalized. And, you know, as patients looking at the media and reading and learning about studies, they always caution to take a little bit of a deeper look. And you can sometimes even ask your doctor to help interpret studies that are being reported in the media because it can be challenging. So based on that pilot study, I was able to get NIH funding to conduct a larger study. And this was a study where we randomized individuals to either the same intervention of mindfulness-based stress reduction or a time and attention matched comparator group of headache education. We all know that headache education can be so powerful to learn information. And so we matched the two groups on time with an instructor. And we found that both groups decreased headache frequency. And what was interesting though, was only the group that learned mindfulness also had reductions in a multitude of other instruments and assessments. And you can see here, pain catastrophizing, headache disability, which is measured through MIDAS. Many of you probably at least in our clinic, do MIDAS before and after Botox treatments, headache management, self-efficacy, depression, quality of life, and mindfulness, and even anxiety. And what was really fascinating was these effects persisted out to 36 weeks. So so really had long-term benefits. And we published this study in JAMA Internal Medicine. We also wanted to understand if this was helpful, how was it helpful? And so we evaluated this biologically by using something called quantitative sensory testing, in which we actually applied heat pain to individuals and asked them to rate both the pain intensity as well as the pain unpleasantness. And the way we describe this is pain intensity is like when you're listening to a radio, how loud the sound on the radio is, and pain unpleasantness, like if you're listening to that sound and you wonder whether or not you like that song on the radio or how much you dislike that song on the radio. That's more like the unpleasantness. And so we had a little ruler that we would ask people to rate that pain intensity and that unpleasantness. And then on the back of the ruler, there was a scale that we could quantify those numbers. And what we found was that individuals who learned mindfulness had decreased perception of pain after they learned mindfulness. So both in pain intensity and unpleasantness. And these effects were statistically significant. So it suggests that when individuals learn mindfulness, it may change the way they perceive pain. So we also conducted a study last year when the pandemic hit. And so when the pandemic initially hit, I was really concerned for patients with migraine because stress can be such a trigger for many patients with migraine. And if you remember at the onset of the pandemic, there was so much uncertainty, just as there is today, but even at the beginning, and there was so much uncertainty as to what was going on and how this would impact our lives. And, it was like living day to day, trying to know what to do and how to be safe. And so I conducted a virtual or online mindfulness session, and participants completed surveys before and after the online session. And initially, we targeted this just to our patients with migraine, and then we expanded it and really included providers at our hospital, as well as anyone who really was interested. And we spread the word online and used social media. I reached out to headache colleagues across the country, as well as internationally. And these are figures where you can see that people across the world participated. We had 233 individuals across the world participate, including 20 international participants. And we found that in the single session mindfulness, before and after the session, we said, at this moment, how much anxiety do you feel? And you can see before this dark purple, 15% said very much, how much momentary anxiety you feel. And then afterwards, 1% said very much. And quite a bit, how much said quite a bit? You can see 26% said quite a bit before, and afterwards, 4% said quite a bit. And then at the bottom end of the spectrum, how much anxiety do you feel at this moment? At the beginning, 5% said not at all. And after the session, 30% said not at all. So you can see that with one 20-minute session of mindfulness, the momentary anxiety people are experiencing can dramatically change. And we saw very similar results for momentary stress, as well as momentary concern over COVID. And this was, like I said, one single 20-minute mindfulness session. So am I saying that 20 minutes of mindfulness can cure anxiety? No, but I'm saying our momentary state of anxiety is really important to pay attention to, and to recognize that those momentary states can influence our overall state of well-being. I also want to acknowledge a lot of other research that's been conducted in the field looking at mindfulness and migraine specifically. And these are all of the countries across the world where researchers have conducted research trying to understand mindfulness and migraine. And this is really powerful to me because it demonstrates there's just a dramatic cross-cultural interest in research in mindfulness for migraine. In addition to the work that we've done, there are many other researchers across the world who are doing research looking at mindfulness and migraine. And I've listed several of the other studies here, specifically looking at different types of interventions. For example, the MBCT is mindfulness-based cognitive therapy, which is using cognitive behavioral therapy infused with mindfulness. And then there's been other studies as well. For example, there was a study looking at chronic migraine and medication overuse headache that Dr. Licia Grazzi did in Italy, showing that in a non-randomized clinical trial, individuals receive the same benefit from mindfulness as from starting a daily prophylactic. So there's a lot of interest in these, and there's a lot of people doing research in this area, and there's a lot of future studies that should be coming out soon as well. So in the study that we published last year, where we did the virtual mindfulness session during COVID, we were really interested in trying to understand what resources are available for patients. And we're struck that during the pandemic, everyone who had been teaching classes in person converted the classes to online and then created online resources. And so we actually created tables to list all of the different online mindfulness resources that are available, because it's so important for during this time where social distancing is important and people are not doing things in person as much. The pandemic has actually increased availability for resources online. I also want to acknowledge all the work that Miles for Migraine is doing. In the last year, Miles for Migraine has just done an extraordinary job providing opportunities for mindfulness. And all of the mindfulness classes and sessions that have been done online are available to watch. So you can watch recordings of other people giving presentations and doing mindfulness sessions online. And then here's a list of all of the upcoming sessions available. So I applaud Miles for Migraine for all of the work that y'all are doing to make this available with experts in the field and fantastic instructors leading these sessions. And a lot of people say, "Oh, so what's the best resource?" Well, now there are so many resources available that it's almost like, how do I choose the right one? And I think this is a very long conversation that we could spend a lot of time talking about. There's lots of apps that are available. For people that are beginning, I find if you can take a class, it can be really helpful because learning mindfulness is really like learning a new skill set or changing the way you do things that you've done a certain way for a very long time. And having an instructor to guide you through that process so that you can ask questions and talk to can really be helpful. One of the things that we often find when people start practicing mindfulness is that initially sometimes stress levels can increase because living a stress-filled life, sometimes you just plow through and keep on going. And all of a sudden, when you slow down and start paying attention to how much stress is in your life, you feel like there's more stress when really there's the same amount, you're just now finally aware of it. And so that can be very disconcerting. And for many, it will turn them off. And people say, God, I'm even more stressed. This isn't working at all. And we'll stop and turn away from it. And I think it's very important to recognize that that's typically when it's most important to turn towards it, to really look at it as an option. There's, like I said, lots of online classes available now, YouTube videos, retreat centers, local classes. So there's just a multitude of options available now. So there really are a lot of future questions that still exist. I'm really fascinated as a neurologist by like, how is this working in the brain? Like, what is going on when people are practicing mindfulness or practicing yoga or other mind-body skills? And understanding, what are the predictors that can assess whether or not this is going to be helpful? When I'm seeing a patient in clinic, if I could have a 3 or 5 item questionnaire to say, oh, you answered these questions, so you are a mindfulness candidate, and this might be something that would be helpful for you, compared to saying, no, this might not be the best thing, because it is a significant investment of time and energy and effort, and sometimes money as well. And so these are things that I think are really important to recognize, and that they don't have physical side effects as often as what we see with medications, but the time and energy investment required is significant. And so knowing what are the predictors of who might be most beneficial would be really helpful. We're really interested in outcomes that patients find helpful. And so this is really going to help direct guidelines for the future in our field as well. And it's also important to recognize and to think about how can we best implement these treatment modalities. And how can we increase access and diversity for these options? And is mobile health or online options, does that increase diversity and make it easier for people rather than in-person classes? Or does it increase the digital divide? So in summary, I think there's huge interest in mindfulness and migraine, and it may change the way people appraise pain. Mindfulness is something that seems to treat total migraine burden and may target disability as well. So I'm really thankful for the tremendous amount of research support that has enabled this work to be conducted. including all of the people. So clinical research is not a solo endeavor. It involves a lot of people. And I think I think Julia Burns is one of my students who's currently on my research team, and she's here this evening. Julia, I give you a shout out because you're doing an incredible job helping with our research now. I have a really fun time doing this research, and I have a lot of great mentors and collaborators and students who make this research possible. And you can see there my Twitter as well. So we're going to have a just brief mindfulness experiential, but before I do that, I think Katie or Helen might want to say a few things.
I think due to time, we are just going to go right into your mindfulness.
Okay.
We after mindfulness, we're going to put up our survey if everyone wouldn't mind joining our survey. But if you want to go ahead right into your mindfulness, that is wonderful.
Great. So we're going to do just like about 5 minutes. You can keep your video on or you can turn it off, whatever you feel most comfortable with. So I'm going to have you, if you feel comfortable, closing your eyes, uncrossing your legs, uncrossing your arms, feeling the weight of your body in your chair, settling in, feeling your feet against the ground, and sitting up in an erect, dignified posture. And bringing your attention to your breath. Not trying to change it or alter it, just bringing awareness to this breath. This life-giving force that allows us to live. We're constantly going and doing, and now is the opportunity just to be. Being present in this moment right now. We are human beings. And we can be present here and now in this moment. As you are bringing your attention to the breath, you may notice it most at your nostrils, with the air coming in and out. You may notice the temperature is different on the way in than on the way out. You may notice the breath most at your chest, with the rising and falling of the breath. Or at the abdomen with the expansion in and out. Wherever you notice it most, just resting your attention there. Breathing in and breathing out. Riding the waves of your breath in and out. And as thoughts come into your head, which they inevitably will, imagine your thought like a cloud, allowing it to float away gently and softly. And with kindness, bringing your attention back to your breath. When your attention leaves your breath, The magic moment is your awareness that it has left. No need to berate yourself or get angry or frustrated, but in that moment, offering yourself kindness, gentleness, curiosity, allows yourself to gently and softly return your attention to the breath. That is the magic moment, because that is the moment you get to be really different. Giving yourself the kindness and loving kindness to return to the breath. Breathing in and breathing out. Knowing that in this moment, you have given yourself a gift of this present moment, because that is the only place where we live, in the present moment, and we can always come back here to this moment. And as you feel comfortable, gently opening your eyes and returning to this room. Giving yourself a moment of gratitude for being here this evening and sharing this time together. Thank you.
Thank you so much, Dr. Wells. I feel very relaxed and I am ready for bed. I see why Dr. Wells is fantastic, and Angel is so lucky to have you. I can see why her talk was so wonderful too, having a doctor like you. So we are putting our survey in the chat section. If you wouldn't mind taking a minute, I want to thank you so much, Dr. Wells, and everyone else, all our other presenters today. We really appreciate it. I want to thank all of our sponsors as well. Please don't forget about our virtual and live run, walk, and relax events, our virtual support groups, and our mindfulness events will continue, as I had mentioned, every other Thursday through the end of the year. And while you're filling that out, I was one that I had never really done mindfulness myself before Miles for Migraine started doing it. And Rebecca was talking about it, and it really has helped me in my migraine journey as well. I've added it to my toolbox, Dr. Wells, and it's definitely made a difference.
Well, thank you everyone for joining us, and thanks to Miles for Migraine for giving us this opportunity to engage together. And we're excited about our Miles for Migraine upcoming Run, Walk, Relax event that'll be in October. That'll be virtual.
That's
so,
right.
Helen,
we're coming down to North Carolina. Well, it's virtual, correct? We just switched it to virtual, but we're excited about it as well. It should be a good one.
Yeah. So Helen, if you can put that in the link too, that'd be great, so people can join us then. So have a wonderful evening, and thank you.
Yes, thank you so much.